Stroke rehabilitation should begin as soon as possible after a stroke. The sooner you begin, the more likely you are to regain lost abilities and skills.
It's critical that strokes in the hospital transition from the acute care part of the hospital to the inpatient rehabilitation unit if they qualify for inpatient rehabilitation services. The first month after a stroke is particularly critical. 90% of all deaths that occur in the first month after a stroke are directly attributable to the stroke spell or its secondary sequela.
Rehabilitation helps stroke survivors relearn skills that are lost when part of the brain is damaged.
First, we adapt to the deficits that we have now and learn to compensate for those. And it's critical that those are not self-directed, self-generating compensations. Those sorts of compensations are also often problematic, dangerous, predispose us to falls, and maybe deleterious to our future functional outcome. We teach compensatory strategies that maximize an individual's functional status in the midst of their deficits today, plus those better compensations allow for integration of physical capacity return or physical gain on down the road, such that the overall big picture of functional improvement is maximized.
Stroke recovery varies from person to person. It's hard to predict how many abilities you might recover and how soon.
We don't really provide for a prognosis early on with strokes. You can be fooled one way or the other and invariably will, but the bottom line is that humans rise to the challenge. They rise much higher than we ever think they would. Our loved one overcomes things that we wouldn't have thought our loved one can overcome. And in general, each day is a little better than the last.
The Christus Cabrini Stroke Center is in place to get you treatment fast.
From the get-go in a continuum of care, we're basically planning for the next step in the continuum. Where do we go from the ER to the ICU to rehab or to a long-term acute care unit and then on to rehab? And so patients are staged along the way with the appropriate consultants and specialists and primary care providers such that they get sort of a comprehensive team approach, interdisciplinary package to their transition through the hospital setting.
The Medical Minute is brought to you in part by Christus St. Francis Cabrini Hospital.